In Spain, while the vast majority of the population support and admire the hard work done by all medical care staff in hospitals, some have decided to harass those on the front line for fears the virus of being brought back to their communities. Jaime Velazquez reports for us from Madrid.
Every evening, Spaniards go to their balconies to applaud and show support to the health workers who are fighting against COVID-19. But behind the facade, inside the buildings, some of these workers are receiving a different welcome. Doctors, nurses and other basic services workers are suffering harassment from some of their neighbours. Messages in their doors are asking them to leave amid fears they may spread the virus in their communities. Elena Garbajosa is a warden at a nursing home in Madrid, one of the hot spots of the pandemic. She would remove her work uniform before leaving to make sure she would not bring the virus home.
A neighbour came to tell me how I could dare working at a health centre. What I should do is disinfect everything I touch, every place I step on, almost everything I put my eyes on.
Days later, she found her doorstep sprayed with bleach.
I couldn't imagine that next to my door I would have people with such attitude towards me. It's sad. You always try to keep the positive side. When I go home and I hear the applause, it cheers you up. These other bad attitudes, I just bury them inside a drawer.
Others have gone even further. This doctor in Catalonia found her car vandalized with a disturbing message: infectious rat. Nurses, doctors and basic services workers insist they take extreme precautions to keep their families and neighbours safe, but for some of them the most difficult thing to live outside their homes is the stress caused by the traumatic situations they go through. Montserrat Martinez is a nurse at an intensive care unit in a hospital in Madrid. She recalls the painful times when the peak of the pandemic strained hospitals to capacity. Some health workers have required psychological assistance. She is lucky to have all the support at home.
It is true, I have cried at times when I left work. I have cried at home. I'd let everything go. I have children and a husband, and they notice I'm bringing a lot of worries home. But they ask me, and they let me speak, and they take care of me. So fortunately at home I have psychological treatment.
These health workers know that the starving voices come from a small minority. As they walk the last steps to the end of the tunnel, just another shot of support will get them going. In Madrid, Jaime Velazquez, Euronews.